Now, if you suspect or you've been told you're a candidate for a total hip replacement, you're in the right place this morning.
That's right. There's a new procedure that's making a huge difference for patients. It's called the direct anterior approach.
You're almost like a doctor the way you said it. We do have a doctor. Dr. Kent Bay is a board-certified orthopedic surgeon with Miller Orthopedic Specialist. Good to see you, doctor.
Nice to have you
Good
here.
morning.
We've got this model, which is cool. We'll get to that in a second. But hips and knees, those are your specialties, right?
Yes, that's correct.
You've been working mostly in Council Bluffs for a few decades now, so a lot of people watching might have been through your office before.
Yes, I do surgery in both Omaha and Council Bluffs and been based primarily in Southwest Iowa for over 21 years.
Helping a lot of people
Let's
throughout
talk
that
about
time.
a hip replacement here. I know people have gotten it, and it's amazing the technology, how far this has come. But I guess what's the most common reason a person would need a total hip replacement?
Well, it's arthritis, and there's really over 100 types of arthritis, but the most common types are osteoarthritis, which is the wear and tear type. Basically, the cushion just starts to wear out, and you develop cysts and spurs, and the hip gets tight and painful. Rheumatoid arthritis is another common type where your body actually attacks the joint and destroys the cartilage that way. But in some form, the joint, the cartilage, and the bone of the joint starts to wear down.
And you can see that in this diagram, the healthy hip on the left, and then the diseased hip, you can see that joint, it is deteriorating.
Yeah, so the gristle on the ball and in the socket basically deteriorates, and this is what causes the joint to become stiff and painful.
The approach that I mentioned earlier, this model helps us understand wonderfully how it's different from techniques of old. So would you explain to us what these different lines mean, and then I'll pop this shell off so you can show us what this new approach is like.
Sure. Traditional approaches to the hip, and in fact, the anterior approach to the hip is not new. It's not been very popular until recently.
So the red line here,
that is a posterior approach.
And the green line
is a lateral approach.
But then if I take this off.
And those are the common, right now, most hip replacements are done through a posterior approach in the world and in the United States.
And you have to go through the muscle though.
Yes. So you can see here, if you make an incision in this way, you have to go through this gluteus maximus muscle, it's called. And I'll just take this off for a second. And then you have to remove further muscles in the back of the hip to get to the back of the hip.
So that's a lot of recovery and a lot of pain.
It is quite a bit of dissection of the muscle.
But this anterior approach, you're saying you go right here in between the muscles.
That's correct. That's the advantage of the anterior approach, is that you can go between the muscles. So in this case, it's between the muscles in this plane. So I'm going to remove this just so you can see, but the hip is directly under it. So it's actually they call it the direct anterior approach. So we go right between the muscles in this fashion instead of through them, and that's the advantage and allows the quicker recovery for the patient.
Yeah, so the quicker recovery. Any special equipment needed for this? I mean, how do you do that, and I mean, is it the equipment that has made this approach easier over the last few years? Or?
Largely, that is correct. The anterior approach was done years ago with a small cemented curved stem that you could slip in from the front. When we went to these non-cemented implants, the new technology, were very hard to put in from the front. It became very unpopular. But now, with this newer equipment that we have, designed specifically for the anterior approach, a lot of it is a special table that we use to put the patient's leg in to manipulate it, called a HANA table. And that particular piece of equipment costs $100,000. So it's a big investment to start this procedure. And we have purchased that and have the special equipment, and this allows us to do the hip through the anterior approach.
We were looking at that list, numerous benefits to patients, from less pain, more mobility, you're back to life sooner than you might have been with another approach. But what about the risks? Are there different risks with this compared to other types of total hip replacement?
Well, that's an excellent question, Mary. The risks are essentially the same. You're going to have the same type of risk of infection, blood clot, or fracture, nerve injury. With any surgery, I tell people it's like getting in your car and driving across town. You could make a list about as long as you'd like of all the things that could possibly go wrong, but it's pretty darn safe, and we've gotten very good at minimizing the risk for our patients.
And the candidates, who's a good candidate for that?
Candidates are mostly anyone with arthritis. There are some people with certain body builds that going from the front would be more difficult, and maybe going to the back would be simpler. So it depends. Not everyone is a candidate for a direct anterior approach, but most people with arthritis are.
Can our viewers contact you directly, or is this something where you need to hear from their family physician first?
Well, we have referrals from family physicians, but my practice is largely word of mouth.
Yes.
So I would say patients are welcome to contact us directly if they would like to see us for an appointment.
2 locations, and those respective phone numbers are listed on the screen now. We also encourage you to visit millerortho.com to learn more about Dr. Boese, about the entire Miller team, and about procedures like this.
And the final result right here is pretty impressive right
It
here.
is.
Yeah.
Yes, hip replacement is a very good procedure. It generally provides wonderful pain relief and return of function.
For years to
Great
come.
information, Doctor.
Thank you, Dr.
Nice to meet you.
Boese. Good
Nice to
see
meet you.
All right, guests of the Morning
Thank you.
Blend start their day with coffee from Pears Gourmet, the official coffee of the Morning Blend. Learn more online at omahamorningblend.com. We'll be right back.